All right, so first, Yue, I just want to say thank you for taking a few moments of your time having this conversation about COVID-19. I know we've had a lot of conversations over the years, and I always feel at the end of those conversations, I feel a little bit more intelligent than I did at the beginning of those conversations. So thank you so much for taking the time to speak with me today.
Of course.
So how about you just take a moment and just kind of introduce yourself, your area of expertise, and why you're qualified to talk about coronavirus 19.
Oh, sure thing. I'm more than happy to. Well, first, thank you for inviting me here to actually chat a little bit about aerosols and also coronavirus. So I'm Yue Zhang, and I'm actually a Ph.D. Already graduate from Harvard. And my research, as I was pursuing my doctor's degree, was about aerosol sciences and atmospheric sciences, which is to study all these little small aerosols that can produce from all the environments, including what people exhale or producing when they are coughing or sneezing, which is very pertinent to the COVID-19 or respiratory diseases spreading. And then afterwards, after my PhD, I also actually working on a postdoc now at University of North Carolina at Chapel Hill, and affiliated with a few other places, including Airborne, and collaborate with MIT as well. So so it's still trying to understand the behaviors of aerosols, which is a medium for coronavirus to actually transmit. And then I'm actually going to be a professor at Texas A&M starting from next year. And then one of my research focus is going to understand the health effects of aerosols. So that's why I'm actually really excited to talk about this. Mm-hmm. And I'm not sure whether you actually heard about it before. So about 239 scientists, especially in my field, the aerosol field, they wrote actually an open letter to WHO talking about the coronavirus, the COVID-19 could potentially be airborne. And then a lot of them actually are my colleagues. So so after this letter was published, so WHO actually accepted it, and then now they revise the protocol and think that the coronavirus could indeed be airborne.
I remember it was about 2-3 weeks ago when that letter came out, maybe just a little bit longer than that. So I know you sent me a few articles to read through about coronavirus-19 being an airborne virus. Do you just want to walk through the science just a little bit and explain it to us?
Yeah, I mean, for sure. So what happened is that initially when COVID-19 happened, so there are two ways for these kind of respiratory diseases, especially viral diseases, to be transmitted. So they have to transmit it into through this droplet that human beings produce, such as when you cough, when you talk, when you sneeze. There are all these different droplets. Sometimes you can see them because they're large enough, but other times these droplets are really small. You can't see them, but they still contain lots of the virus.
Yeah.
And then, so if the droplets are large enough, then what's going to happen is that they can quickly settle down onto a surface. And then when a healthy person touches this already contaminated surface, and then put a wipe on their face or their eyes or nose, then the virus can have direct contact with human cells and essentially infect people. So we call this contact transmission. But there's another way of transmitting it. It's called airborne transmission. That's when those aerosols or these droplets are super tiny. Normally they're about a few micrometers to even nanometer scale. And because of they're so small, and human beings actually can't see them due to the small size, but these droplets can still remain in the air for a long time instead of just quickly settle onto the surface. Then if a healthy person walks through this area or pass through this area and inhale this polluted air, then they can actually be infected with the virus. So I think for the COVID, initially people think it was mostly through contact transmission. But then with more evidence being produced and observed, then people start to notice that it actually could also go to airborne. And airborne could also compose of a relatively significant ratio if people don't really be careful about it. So that's why those articles were actually trying to say people should be also vigilant about this and wear face coverings just to prevent this, which is one of the main way, to prevent it.
So then how do scientists go about testing it to see if it's an airborne virus?
Yeah, so to do this, there are two ways to do it.
Hmm.
One is more from what you see from all these instances, and then try to derive what's common in them. The other one is you can do in the lab and try to see the opportunistic infection rate. Yeah, so I think people first actually found out through all these different instances, such as it first had an outbreak in China. So China contained some of it, but they found out that in certain cases, so they did a very good job actually tracking all different cases, trying to understand where people contacted. They found in one case, actually there were at least three different separate groups. They were eating in a restaurant, and then they were all like eating, with their own family and friends, and then on their own table, so they did not have any contact with each other. And then all these tables were actually relatively far apart, meters to even tens of meters. But then, because one person from the upstream of the airflow was infected with coronavirus, later on, of quite a few people from downstream of the airflow in that restaurant were also infected. And because the distance is much farther than what contact transmission could be found, so that's actually one way people determine it must be through airborne. The other way actually happened in the US. I have another example, which happened in Washington State. So people actually did a choral practice at a church for about 2.5 hours, and there were 61 members there. And then, for choral practice, the room is normally relatively big. So for the people sitting at the front compared with people sitting in the back, so they have a really large distance, more than 20, 30 feet, or sometimes maybe even 50 feet. But then they found that because one person was infected, the whole room, actually, they found that maybe 80% of people, around 80% were infected. And then even 3 people were severe enough to be sent to the hospital, and 2 of them died from these incidents. So that's also another example to show that it could really be airborne. So these are so far what scientists have been working on from the examples. But then there are also people working in the lab try to understand how if certain virus is actually in the droplets in aerosol format, then how easy it is for airborne transmission to happen.
Okay, yeah. So it just sounds like from those examples, it gave you like the evidence or the direction of where to be studying it to try to determine if it was airborne. Is that correct?
Right. Yes.
Okay.
So I think this already confirmed it's airborne, but now one of the part that the academic community is trying to understand is to see how frequent it is, and then what's the risk for different activities for people to be infected through airborne pathway.
Yeah. So I guess that leads to like a really good question. So if somebody's in a confined space, at a school, in a gym, at church, how long does this virus stay airborne in those spaces, especially if there isn't great ventilation in the buildings?
Yeah, so that's actually a really good question. I mean, the short answer is it really depends on the situation. But I can give some analogies trying to help people understand, because I think the detailed quantitative answer is still trying to be analyzed. Okay, so one thing is that the smaller these aerosols are, or these droplets are, like containing the virus, then the longer they could stay in the air floating without settling. So for 5 micrometer droplet, so that's about like 1/20th of the human hair's diameter.
20th,
And then so it's only 1/20th, so it's really small, and they can actually stay for significant time and even travel about like tens of feet, maybe 10 to 20 feet. And then for particles that are less than 1 micrometer, which is even smaller, then they can stay for hours sometimes. And for those submicron particles, sometimes they can even stay for days. So that means they can stay there for a long time, right? But it's also due to the this transmission rate is also due to the viability of these virus-contained droplets. Even though they can stay for very long, but sometimes maybe after a whole day, when the room is very dry, the droplet will quickly evaporate and become solid, and the virus may not be active anymore once they lose water. And another thing, so is the ventilation frequency of the room. If it's in a relatively confined place, there's not too much ventilation, then this concentration will just gradually be built higher and higher. You will inhale a higher viral load, which will make it easy to infect you. But if you are in an area which has a lots of ventilation, like AC is turning on and circulating the whole time, and then that actually may remove some of these particles and then reduce your risk. So it really depends on different situation. So to minimize your risk, then I would think that people should try to actually remain a little bit distant from each other and also wear a face covering, so that even though there may be some in the air, but once it passes your mask, then a certain percentage of these aerosols can be blocked, so you will reduce your rate.
Yeah. So we're hearing a lot about 6 feet. Do you think 6 feet's far enough? Should it be further than that if it's an airborne?
So yeah, so for 6 feet, I think that was actually based on one of the early research paper that published in the, I think in the 1930s, if I wasn't mistaken. At that time, people were analyzing relatively large droplets, so they found it could be 6 feet. But then, with advancement of scientific technology, so now we can see much smaller droplets, and then we found that they still contain virus, can infect people. For instance, for flu, it sometimes can be airborne too. And then there are also other kinds of coronavirus-caused disease in the past that people also found they could be airborne. So for those kind of ones, then 6 feet would not actually be enough for certain cases. Certain cases they are, but other cases are not, especially in those indoor environments where the ventilation is not as good as outdoor.
So it kind of sounds like there just needs to be more research to determine what a safe distance is.
Yes, and it's also highly dependent on each exact scenario, and so it's a little bit hard to give a quantification. I would say if people can stay a little bit farther, especially for indoor environment, that would reduce their risk.
Okay. And then outdoor, it sounds like from what everything that you're saying, it's going to evaporate a little bit quicker. There's more ventilation outside, so you're at a much less risk outside than indoors, correct?
Yeah, so for the risk for the same kind of behavior than outdoor due to its more ventilation and the wind and everything, so it's actually much lower. But it's also depending on difference. For instance, if a person is actually talking normally indoor, right, with a face covering compared with a person who is yelling very loud or maybe have a cough right towards your direction, then that's also going to put you more at risk even for outdoor, just because a person was right coughing or sneezing at you compared with an indoor person just talking. So I think one way to actually quantify it is for this airborne infection is trying to imagine that if you have a person smoking, and then how far away do you think you cannot smell his smoke? Then that's probably a more conservative, safe distance that will prevent you from having airborne infection. Because for those smoke, they are also aerosols and they also travel for a certain distance. So their kinetic behavior is a little bit similar to all these droplets that coronavirus also are in. So yeah, so that's something I think people can use as a guideline.
Yeah, actually, that makes me think a lot, because when you're indoors, if you're in a room with somebody smoking, anywhere in that room you're at, you're going to smell the smoke. But if you're outdoors, the ventilation's much greater, so you can be a little bit closer to that individual without smelling the smoke.
Yeah, that's true. Yeah, you're right. I mean, for smoking, there's also some gas there, but if you can see where the smoking plumes travel, that's very similar to the aerosol. Yes.
So in some of the articles that you sent me, I saw, I think it was 79% of the individuals that were tested positive for it in China, in Wuhan, they were asymptomatic. And now in the United States, we're having 60, close to 70,000 positive tests a day. Are we at the point in this country where we're beyond being able to do the contact tracing, the contact testing?
Yeah, so that's also a very good question as well. So there are also different levels of contact testing. I think it is very difficult now. I think CDC even agrees as well that to do each individual level contact tracing to find out how did you get infected, just because the case number is too high and we don't have enough people to track each person. And there are also other issues. For instance, when people do coronavirus tests, sometimes they don't have to leave their full information, so they have to leave the name for sure and a few other information. But it's sometimes a little bit hard to reach out to the person, and then if they do not want to be reached out to do contact tracing on them. Yeah, so I think that's one of the disadvantages. Is a little bit hard to know how things are going to be. However, people can still try to do some regional or smaller scale contact tracing, especially when in those areas the infection rate is not too high, or maybe people can do some broad generalized level tracing to see what the trend of the coronavirus it is, but it's just difficult to do individual level now, unfortunately.
Yeah. So do you think going into the fall, the numbers are going to continue to go up? I mean, I know we had a few days last week where we hit over 75,000. Do you think it's possible we're going to be hitting over 100,000 at any time?
Yeah, so I mean, that's a really good question. I mean, based on the current trajectory, then I do think that it is very likely to actually reaching the tipping point of 100,000 cases per day, unfortunately. And but regarding when, it's going to be depending on how strict each state is going to be for putting people more indoor and to raise everyone's awareness of being social distancing and wear face coverings. And in the fall, based on the current trend, the number of cases may still increase if people actually still perform the same level of vigilance as now, just because when we compare with typical flu or other coronavirus-induced cold, then the fall and winter time and even early springtime, they are indeed very active times for those things to happen, just because the sunlight is also a little bit weaker, so the virus can stay longer, and people's immune system may also just be just a little bit weaker in the winter times. So with all these factors all play together, and then when people behave the same way, then it will increase, unfortunately.
Yeah,
but
I think that's a really good point, just talking about like the sun not being as strong in the shorter days as well.
Yeah.
I never even thought about that. I was always kind of thinking about just staying indoors and being exposed to it more, but I never even really thought of it like that, but it makes a lot of sense.
Yeah, that's true. I mean, I hope that maybe people will be more vigilant, and everyone will just be very careful in the fall and the winter. So hopefully the cases are not going to increase too much, or maybe even tapering down and then just going even way lower. That's my hope.
Yeah. I mean, here in New Jersey, I've definitely seen a lot more people wearing masks. To me, that's a very encouraging sign going. I mean, I know it's still like in the heart of the summer, but if that continues, that's an encouraging sign for me going into the fall. But I was just recently in Ohio visiting my parents, and I was a little bit shocked with how few people were wearing masks in my hometown. So that kind of made me a little bit nervous. It kind of made me nervous about my parents as well, because I know they've been self-isolating now really for about 6-7 months. And my sister and I were really pushing for them to continue that. But I know at some point they're going to want to get on with their normal lives. And I feel a little bit bad for them, because it is in their golden years of their lives. And it seems like they have to sacrifice an entire year of those years. So I know it's a little bit difficult for them.
Yeah, I agree. It is a relatively difficult time, especially for some people, very difficult at this time. But I'm just going to say that I think it's a collective effort. The more people are trying to perform social distancing and also wear face coverings, then the quicker we can actually bring the cases down. So the easier it is for people to go back to their life normally. Otherwise, it's going to be just continue to become worse and worse, and it's going to infect more and more until we reach the point of a lot of the people are infected and we reach herd immunity, which is going to be too much of a cost, I think.
Yeah. So can I ask you, what are you worried about going into the fall?
So going to the fall, so all these meteorological conditions will favor the spreading of the virus to be even more severe than the summer. So my worry is if people still act the same way, then the cases will just keep increasing even further compared with what we have now. So and then there will be too many people potentially get ill or even having like permanent side effects or long-term side effects or even die from it. So I think that's my worry, and it's also going to hurt the economy even more if people are not very careful with this. Yeah, so my hope is that the people will be more and more vigilant to help bring the cases down.
Okay, sounds great. And then we'll just end this conversation with what are just some of your words of wisdom? What can people be doing right now to really, I know normal's still a way off, but what can people do now to protect themselves, their neighbors, their friends, and have some sort of a normal life where they can go visit and, not just be, cooped up in their house all day?
Yeah, so I personally don't have a crystal ball, but I would say based on science, then maybe it's good for people to try to wear face coverings as much as they can and try to clean your hands and avoid touching your face, especially after you come out from public places. And then the other part is if you notice anyone who potentially may be sick and have any symptoms, try to get tested as soon as possible and quarantine yourself or the person so that they won't spread to other people. And I think that I do believe that with everyone just acting together, we do can contain the virus eventually. It's just a matter of time, but it's also a matter of how much effort we want to put in.
Yeah. No, I agree with that because I was just looking at the numbers out of Europe today. I think over all 47 countries and territories, there was a total of 17,000 new cases. And in the United States, there was over 60,000 today. And I know back in April, May, some countries were in the same situation that we were. And they are in a situation to reopen their schools. And I think they are in a situation where they can still do the contact tracing and keep the virus contained. And I do worry in the United States we're beyond that. So that's what scares me right now.
Yeah, I mean, I agree with you. I mean, U.S. now is the total cases is actually #1 of the world, and then we're really trying to reduce as much as possible. Otherwise, in the fall, it's going to be even harder. And I actually remember one other thing I was going to mention too. People who might be interested to protect themselves is if they are in a confined space and with relatively less ventilation than they feel comfortable with. For instance, if we go to somewhere that doesn't have good AC, or even if they travel on an airplane, I would say sometimes they can also put on goggles, which people say it may also help as well. Because I remember there were some people, especially one person who was working for CDC. He said he was already very careful, but then he was still infected, and he suspected he was infected maybe doing an aircraft flying through the eye, because the coronavirus can also enter through your eye and infect your body. So wearing some kind of goggles or even glasses will actually help to prevent you from getting infected, or at least reduce your chance.
Right. Yeah, I know my wife's a teacher, and going into the fall, they're doing a hybrid model. So they'll be at the school 1 week, then home 1 week, and the school is buying all the teachers' face shields for them. So we were pretty happy. I'm sure it's going to look a little silly when we take photos of that, but I was very happy to see that the school was making that investment, keeping the teachers safe.
Yeah, I actually start seeing some of the people even wearing that for cashiers at supermarkets. I think that's very smart to just protect themselves or protect the employees.
Yeah. Well, Yue, I just want to say thank you again. I think this was a very informative conversation. Like I said at the beginning, I always enjoy the conversations with you because I do feel like I am more intelligent after spending 30, 40 minutes talking with you. And also, thank you so much for many years of great friendship. I'm looking forward to coming up to Boston here in a couple of weeks to visit with you.
Thank you very much. I mean, it's actually always nice to chat with you as well, and I really enjoy this opportunity to talk
Mhm.
about some of the research that people have been working on to the general public. So thank you for
Yeah.
having me.
And also, I need to thank, I don't know if I ever thanked you for this. Early on, when the virus was coming to the United States, you were the one who kept reaching out to us, giving us general information. And I think that helped, especially with where we lived. We lived in Bergen County, right across the Hudson River, where, you know, in March, April, we were the epicenter. I do believe that that information kept me and my family safe. So thank you so much for that. Greatly
Oh,
appreciated.
of course, no problem. Yeah, so this virus now is because it's already becoming it's already a global pandemic. So really needs international collaborations as well. Like a lot of the measures that other countries did in the past, can also be used for different countries. And then so it's a good opportunity for the world to actually collaborate on this and combat the virus together.
Perfect. Thank you so much, Yue.
No problem. Thank you.